Hello everyone. Welcome to One More Thing. I'm Matt. Today, we have a crucial topic to discuss, the top 10 most common causes of death that people encounter worldwide. It's important for us to understand these causes and how they can profoundly impact our lives. By raising awareness about these factors, we can take proactive steps to prevent or manage them. So, let's dive right in and explore these critical aspects of our health and well-being. Today we are going to talk about an important topic, 10 common causes of death. Life is priceless, but understanding these common causes of death is critical to our health. This is not meant to lull us into fear, but to help us better protect ourselves and others. We should care about these issues, both for ourselves and for those we love. In this video, we will share with you 10 common causes of death and provide some preventive measures and suggestions. From heart disease to cancer, stroke to accidental injuries, we'll dive into the importance and impact of each cause. This is not only a topic about death, but also about the value of life and the opportunity to cherish it. By understanding these causes of death, we can take better care of our health and make good choices in our daily lives. So, let's embark on this journey together to discover the truth behind these causes of death and learn how to prevent and manage them. This is valuable knowledge that we hope to share with you as we pursue our goals of health and longevity together. Now, let's start exploring 10 common causes of death. Heart disease. Heart disease is one of the most common causes of death worldwide and has a serious impact on people's health. It includes a variety of diseases, the most common of which are coronary heart disease and myocardial infarction. Coronary heart disease is a type of cardiovascular disease that is usually caused by narrowing or blockage of the coronary arteries. When a coronary artery becomes blocked, the heart muscle does not get enough blood and oxygen, which can lead to heart pain, angina, or myocardial infarction, death of heart muscle cells. Myocardial infarction is a serious condition that can lead to heart failure and even be life-threatening. Cancer. Cancer is another common fatal disease that poses a huge threat to human health and life. It is caused by the uncontrolled growth of abnormal cells. Cancer can occur in any tissue or organ, and there are many different types. Lung cancer is one of the most common cancers and is often associated with smoking, but can also be related to other factors such as second-hand smoke exposure or environmental pollution. Breast cancer is the most common cancer in women, but it can also occur in men. Other common types of cancer include colorectal cancer, prostate cancer, cervical cancer, liver cancer, bladder cancer, etc. Early screening plays a key role in preventing cancer. By getting regular and appropriate screening tests, cancer or its precursors can be detected early, which can provide earlier opportunities for treatment and improve the chance of successful treatment. Common early screening methods include mammography, X-ray of the breast, colonoscopy, examination of the inside of the large intestine, pap smear, examination of abnormal cells in the cervix, etc. The importance of early screening cannot be underestimated to help identify high-risk groups and provide opportunities for early intervention. Stroke. Stroke is a common and serious medical emergency that poses a major threat to people's health and quality of life. Stroke is caused when part of the blood supply to the brain is damaged or interrupted, leading to a lack of oxygen in brain tissue and cell death. This may be caused by a blocked blood vessel or a ruptured blood vessel. Strokes can be divided into two main types, ischemic stroke and hemorrhagic stroke. Ischemic stroke is the most common type and accounts for the majority of stroke cases. It occurs when a blood vessel becomes blocked, possibly caused by a blood clot or narrowing of the artery. A hemorrhagic stroke, on the other hand, is caused when a blood vessel ruptures, causing bleeding in the brain tissue. Risk factors for stroke include high blood pressure, high cholesterol, diabetes, obesity, smoking, heart disease, family history of stroke, age and gender. In addition, poor lifestyle habits such as unhealthy diet, lack of exercise, chronic stress and excessive alcohol consumption may also increase the risk of stroke. Symptoms of a stroke can vary depending on the type and severity of the stroke, but common symptoms include sudden weakness or numbness in the face, arms, or feet, sudden difficulty speaking, sudden loss or blurred vision, sudden severe headaches, difficulty with balance and coordination, etc. If you develop these symptoms, you should seek medical attention immediately, as early intervention can reduce the damage to the brain caused by a stroke. Chronic respiratory diseases. Chronic respiratory diseases are a group of common and serious diseases, including chronic obstructive pulmonary disease, COPD, and emphysema, which have a significant impact on health. These diseases primarily affect the respiratory system, causing airway inflammation, airway obstruction, and damage to lung tissue, which can lead to difficulty breathing and insufficient oxygen intake. Chronic respiratory diseases have widespread and serious impacts on an individual's health and quality of life. They can cause long-term breathing difficulties, coughing, phlegm production, and chest tightness. These symptoms may gradually intensify, making daily activities difficult and affecting work, sports, and social life. In addition, chronic respiratory disease increases the risk of complications such as respiratory infections, lung disease, and cardiovascular disease, which can be life-threatening. Avoiding smoking and breathing pollutants are key measures to prevent chronic respiratory disease. Smoking is one of the leading causes of COPD and emphysema. Harmful substances and chemicals in smoke can damage lung tissue, causing chronic inflammation and airway obstruction. Therefore, quitting or avoiding smoking is the best way to reduce your risk of chronic respiratory disease. In addition, respiratory pollutants such as industrial pollution, indoor air pollution, such as soot, gas, and chemicals, are also associated with an increased risk of chronic respiratory diseases. Maintaining a clean and well-ventilated environment and avoiding long-term exposure to these pollutants is critical to protecting respiratory health. Accidental injuries. Accidental injuries are one of the leading causes of death and injury for many people and include conditions as varied as traffic accidents, falls, fires, poisoning, and drowning. These unexpected events can occur at any time in daily life and have serious consequences for individuals and society. Therefore, preventing accidental injuries has become an important issue and requires our joint efforts to reduce the occurrence of these injuries. Traffic accidents are one of the leading causes of accidental injuries. Obeying traffic rules is one of the key measures to prevent traffic accidents. Drivers should strictly obey traffic signs and signals, maintain an appropriate speed and stay focused on the road. Pedestrians should use sidewalks and pay attention to traffic conditions when crossing the street. Additionally, drivers and passengers should always wear seat belts, which is one of the key factors in reducing injuries. Falls are another common cause of accidental injuries. To prevent falls, we should keep the environment safe. This includes keeping floors dry and clean, removing obstructions, ensuring walkways and stairs are adequately lit, and installing assistive features such as handrails. For the elderly and frail, using a walker or crutches can provide additional support and stability, reducing the risk of falls. Fire and poisoning are also important causes of accidental injuries. To prevent fires, we should ensure that fire safety measures in homes and workplaces are effectively implemented, including the installation of smoke detectors, fire extinguishers, and fire alarm systems. Also, check electrical equipment regularly to make sure you are using appropriate power plugs and cords, and avoid burning items such as candles and tobacco that are left unused for long periods of time. The risk of poisoning can be reduced by careful use of medications and chemicals. Medications should be used according to your doctor's instructions and avoid abuse or misuse of medications. When handling chemicals, care should be taken to use personal protective equipment, maintain a well-ventilated environment, and avoid direct contact with hazardous substances. Diabetes. Diabetes is a chronic disease that affects the lives of millions of people around the world. Diabetes is a metabolic disorder characterized by high blood sugar levels, which is caused by insufficient insulin or the body's resistance to insulin. The disease can be divided into two main types: type 1 diabetes and type 2 diabetes. Type 1 diabetes is an autoimmune disease that usually occurs in young people in which the pancreatic islet cells do not produce enough insulin. This type of diabetes requires daily injections of exogenous insulin to control blood sugar levels. The causes of type 1 diabetes are not fully understood, but genetic and environmental factors may play a role. Type 2 diabetes is the most common type of diabetes and accounts for the majority of all diabetes cases. It usually occurs in adults, but in recent years there has been an increase in young people as well. The main cause of type 2 diabetes is the body's resistance to insulin, and the inability of the pancreatic islet cells to produce enough insulin effectively. This is linked to lifestyle factors such as genetics, unhealthy eating habits, lack of exercise, and obesity. Diabetes causes a series of health effects. High blood sugar levels can damage the eyes, kidneys, nervous system, and cardiovascular system, and increase the risk of heart disease, stroke, and other serious complications. In addition, diabetes can lead to serious consequences such as vision loss, kidney failure, lower limb amputation, and neuropathy. Liver diseases. Liver diseases are a group of diseases involving the liver that can have a significant impact on the health of many people around the world. The liver is one of the most important organs in the human body, responsible for many key physiological functions, including metabolism, detoxification, protein synthesis, and bile secretion, among others. There are many types of liver diseases, including hepatitis, cirrhosis, fatty liver and liver cancer. The most common of these is viral hepatitis, including hepatitis caused by the hepatitis B virus, HBV, and hepatitis C virus, HCV. These viruses can spread through contact with blood and other bodily fluids and cause inflammation and damage to the liver. If left untreated, viral hepatitis can turn into chronic hepatitis, eventually leading to cirrhosis and liver cancer. Cirrhosis is the result of fibrosis and abnormal remodeling of liver tissue, resulting in impaired liver function. It is usually caused by long-term chronic hepatitis, alcohol abuse, fatty liver, and other liver etiologies. Cirrhosis is characterized by structural changes in the liver, including fibroplasia, nodule formation, and hepatocyte death. This can lead to serious complications such as liver failure, ascites, jaundice, and hepatic encephalopathy. Fatty liver is a state in which excess fat accumulates in liver cells. This can be caused by factors such as obesity, high blood pressure, high cholesterol, diabetes and excessive alcohol consumption. Fatty liver can be divided into non-alcoholic fatty liver, NAFLD, and alcoholic fatty liver, AFLD. If left unchecked, NAFLD can progress to non-alcoholic steatohepatitis, NASH, a disease of liver cell damage and inflammation. Liver cancer is a malignant tumor that originates in liver tissue. It is usually caused by a variety of factors such as cirrhosis, chronic hepatitis, hepatitis B or C virus infection, fatty liver, and genetic factors. The early symptoms of liver cancer are not obvious, so it is usually diagnosed at an advanced stage. Treatment options for liver cancer include surgical resection, radiation therapy, chemotherapy and targeted therapy, but the prognosis is still not optimistic. Suicide. Suicide is an extremely serious problem that causes tremendous pain and tragedy. Every year, many people around the world lose their lives to suicide, and suicide rates remain high. This issue requires our attention and action to protect and support those who may be at risk. When discussing suicide, we cannot ignore the importance of mental health. Suicide is often the result of mental health issues such as psychological stress, depression, anxiety, hopelessness and feelings of hopelessness. Providing mental health support and care is therefore key to suicide prevention. First, we should work to change society's views and attitudes toward mental health. Reducing the stigma and discrimination around mental health issues and recognizing them as a disease can help make it easier for people to seek help. We should encourage open dialogue, allowing people to share their emotions and concerns, and provide support and understanding. Second, it is crucial to provide psychological counseling services that are accessible and of high quality. Counseling can provide professional support and guidance to help people deal with their emotional and psychological distress. These services should be widely available in the community and should be affordable and non-discriminatory to all. Pneumonia. Pneumonia is a leading cause of death worldwide and poses a serious threat especially to the elderly and those with weakened immune systems. Pneumonia is an infection of the lung tissue that can be caused by bacteria, viruses, or fungi. The disease causes damage to the respiratory system and can lead to serious health consequences, even death. To deal with pneumonia, it is very important to get vaccinated against pneumonia. Pneumonia vaccines can provide protection against specific pathogens, reducing the risk of infection and disease. The pneumonia vaccine is especially important for the elderly and those with weakened immune systems, who are more likely to become infected and develop severe pneumonia symptoms. Getting vaccinated boosted their immune system, lowered their risk of pneumonia, and lessened the severity of the disease. Also, practicing good hygiene is crucial to preventing pneumonia. This includes washing your hands frequently, especially after touching your eyes, mouth, or someone who is sick, avoiding close contact with people with respiratory infections, avoiding touching your face, especially your nose and mouth. Coughing or sneezing with a tissue or cover your mouth and nose with your elbows, regularly clean and disinfect commonly used items and surfaces, etc. These simple hygiene practices can reduce the spread of pathogens, thereby reducing the risk of contracting pneumonia. In addition, avoiding factors such as smoke and air pollution are also important measures to prevent pneumonia. Both smoking and passive smoking damage the respiratory system, lower immunity and increase the risk of pneumonia. Therefore, if you are a smoker, quitting smoking will have a positive impact on your physical health. In addition, breathing harmful substances in polluted air can also have a negative impact on lung health. Try to avoid staying in an environment with serious air pollution, and pay attention to the quality of indoor air, use an air purifier or maintain a well-ventilated environment. Kidney disease. Kidney disease is a group of conditions involving impaired kidney function that can have serious health consequences. The kidney is one of the most important organs in the body. It is responsible for eliminating metabolic waste, regulating fluid balance, producing important hormones, and maintaining stable blood pressure. When the kidneys are damaged or malfunction, it can lead to a buildup of toxins in the body, electrolyte imbalances, water retention, and other health problems. Kidney disease can be caused by a variety of causes, including high blood pressure, diabetes, kidney stones, infections, autoimmune diseases, and genetic factors, among others. These factors can damage the structure and function of the kidneys, which in turn can lead to the development of kidney disease. Some common kidney diseases include chronic kidney disease, kidney stones, kidney failure, kidney cysts, and nephritis, among others. Chronic kidney disease is a slowly progressive and irreversible impairment of kidney function, often closely related to chronic diseases such as hypertension and diabetes. It may have no obvious symptoms for a long time, but as the disease progresses, patients may develop problems such as fatigue, edema, hematuria, frequent urination, and bone pain. Chronic kidney disease requires early diagnosis and treatment to slow the progression of the condition. Kidney stones are solid substances formed by crystallization of calcium, uric acid, and other substances in the body that form in the kidneys. These stones may cause symptoms such as severe lower back pain, blood in the urine, and frequent urination. The key to preventing kidney stones is maintaining adequate water intake, proper diet control, and avoiding excessive intake of substances such as uric acid. Kidney failure refers to the complete loss of kidney function and the inability to effectively remove waste and excess fluid from the body. Kidney failure is divided into acute and chronic forms. Acute kidney failure is usually caused by sudden kidney damage, such as severe infection, dehydration, or kidney ischemia. Chronic renal failure is caused by the progression of long-term chronic kidney disease. Kidney failure requires immediate treatment and may require methods such as kidney dialysis or transplantation to replace kidney function. Renal cysts are fluid or solid masses that form on the kidneys. They may be congenital or acquired. Renal cysts are usually asymptomatic and in most cases benign. However, in some cases, kidney cysts may enlarge and put pressure on kidney function, causing symptoms such as low back pain, hematuria, abdominal fullness, and high blood pressure. Treatment depends on the size of the cyst and the severity of symptoms and may include medication, cyst aspiration, surgical removal, or other interventional procedures. Nephritis is inflammation of the kidneys, often caused by infection, immune system abnormalities, or other diseases. Nephritis may cause damage to kidney tissue, affecting its normal function. The disease may cause urinary abnormalities such as proteinuria, hematuria, and frequent urination, as well as symptoms such as edema and high blood pressure. Treatment of nephritis depends on its cause and may include antibiotic therapy, immunosuppressants, steroid drugs, and symptomatic treatment. These causes of death, such as cardiovascular disease, cancer, respiratory system disease, and kidney disease, have caused a huge threat to people's life and health. Therefore, we call on the audience to pay attention to their physical condition and stay alert at all times. Get regular health checkups, understand your risk factors, and follow your doctor's recommendations for prevention and management. This may include maintaining a healthy diet, getting enough exercise, quitting smoking, and limiting alcohol consumption, among others. Thanks for watching. Please like, subscribe, and sharing. We will bring you more valuable videos. See you next time.